Hi, my name is Craig Hall, and in this training we're going to talk about how email and text-based messaging can become the central point to continued engagement with populations. I've been working with the Healthy Capital District Initiative on helping to shape some of the communication elements in the Capital Region PHIP. And in this workshop, everything we're going to discuss is achievable. Oftentimes when we start looking at marketing communications, we end up with big ideas that are just really difficult to execute for a variety of reasons. But what we've done is created a discussion that is focused on how can we implement some new communication tools that are achievable at a local regional health department point of view, and something that can be used to improve communications with populations throughout the community to ultimately address some of the health priorities, not only across our region but across our state and across our country. The goal of this workshop is to get us thinking about how some of these solutions can be leveraged or inserted into our communication plans, into some of our grants when it comes to how are we going to connect and communicate with the populations. But that's the goal. That's what we're trying to achieve, is to get us thinking about how we might be able to incorporate email and text-based messaging in areas that maybe we haven't done before. There's no one solution to public health communication, and we all know this. It's a balanced mix between online and offline communications. But one of the things that's important, and as I've been talking to directors of health departments in the region, with some looking at getting their public health accreditation, one of the things that continually stuck out to me was the need to create a two-way communication channel between local health departments and the population. And some of what we're talking about today certainly can be leveraged to address this issue. I want to pause here for a moment before we continue on in this discussion, because this is an important statistic. This data is from 2013, so it's probably grown a little bit. But when we start talking about digital and we start talking about digital communications, oftentimes we get focused on the percentage of the population who may not be connected. And that's true, that we have members of our community who aren't connected to information digitally. And we're not proposing that we stop engaging them in the ways we've always engaged them. But look at this statistic. 91% of Americans had cell phones, 81% of them using them to text, and 52% of them using them to access emails. Now, we know that there's room to deepen those relationships, to connect with people within those 81% of individuals who are using cell phones to text to help improve health, to address health priorities and improve health outcomes. Now, it is true that the way certain communities and certain individuals within certain populations use their cell phones is different, and we get that. And it's important to recognize that if we're going to put together a campaign, and we know that a large portion of the people we're trying to reach have prepaid phones, and they might only have a number for 3, 4, 5, 6 weeks. How we structure this, if we should choose to integrate text-based communication, would be different than for users that we know have had their cell phones for a decade. For a lot of us probably listening to this, we've had our cell phones for a very long time, but not everybody does. And so there's not a one-size-fits-all solution to even this discussion. What is a digital-first approach? A digital-first approach is really recognizing that we're in a digital age, and it's not a digital versus traditional communication, but how do we connect and communicate in a digital age when we have things like electronic health records, reminders getting sent out via text and email, or automated voicemail messages coming from our provider office? And it also recognizes that some individuals are not connected digitally. So it's not about digital versus traditional, but it's about recognizing that we are in a hyper-digital age, and digital communications is everywhere, but yet still there are some members who are not connected. And we have to account for all of this in our strategies to communicate and connect with populations. What a digital approach is not is social media. Now, I want to pause. I'm not saying that social media is not important. Social media is an important element for health departments that can use it. Some health departments can't even use social media. But I want to make sure when we get talking about digital that we don't just immediately let our minds run to Facebook, Twitter, LinkedIn, Google+, Instagram, whatever the next phase of social media may be. It's an aspect of a digital strategy. It's one of the channels. It's one of the places where we should consider putting messages, but it's not the strategy itself. And this is very, very important because if we let social media kind of dominate our thinking around digital communications for public health, we're going to go down a road that I think is probably not as beneficial and doesn't have the maximum amount of return for our time, effort, and resources available. But when we're looking at developing resources, we're looking at building communications, why not look at distributing them across social media if we have authorization to do so? The strategies that we're going to talk about, text and email, have the ability to leverage technology to help improve outcomes that we know are dependent on helping individuals change unhealthy behaviors. It's not a one-time event. Throughout our training and throughout the program that we're running here in the region, we've built a sample campaign just to kind of give some life and give some visual to some of what we're talking about. And we did it around diabetes. If I'm an individual who's just been diagnosed and now I'm a diabetic, I entered a new reality, and I have a lot of lifestyle changes that need to happen for me to understand how to monitor blood sugar levels, how to understand those blood sugar levels, how to manage and maintain them through potentially insulin, eating properly, exercise. There's a whole host of things that I now have to learn and do that I didn't have to do before. And this is not a one-time event. This is a series of ongoing and intentional actions of individuals who choose to own their health. So where the tools and strategies we're talking about can come in to help supplement the engagement that currently exists through care coordinators, through providers, through specialists, through community organizations and other means that we have to educate and connect with individuals. So let's jump into email. And when we talk email, I'm going to kind of interchange some of these ideas between email and text because there's overlap in kind of how they work and how the strategy might apply into your communication plan. So I'm going to take the second one first, the blast emails. We're all familiar with the blast email where we create an email, often a newsletter style or a single communication. We put together our list, 2, 3, 4, 500, 1,000, 2,000 people, and we send it out to them. A very effective tool for communicating to partners and organizations and even to consumers if we have the right individuals on the list. But what I want to really focus a lot of the rest of the conversation on is automated email follow-up messages. And this is true of automated text follow-up messages as well. But picture we build message 1, 2, and 3 that we set to go out, day 1, day 7, day 14, a series of messages go out when an individual has signed up for a message or text, has initiated the desire to receive our information via text messaging. And we're going to look a little bit about the technologies that are required to distribute and track email and talk a little bit about why it's important to use these technologies and some of the best practices that we're communicating and sharing in this training. Here's an example. Again, this is a draft. This is a sample that we put together, to illustrate, how it could look. But imagine, going back to our diabetes example, we have a 3-part series where we build it, and I come in and I sign up for the series today, and I get message 1. you come in next week and sign up for the series and you get message 1. And 7 days from then you get message 2, 14 days you get message 3. And going back to what we already kind of discussed, this is to help fill the gap. We would love to be there throughout this entire journey for an individual consumer as they start to own their health and make different choices and change behavior, which is very, very hard to do, and we all know that. So this is designed to help supplement and deliver a series of information based and potentially even motivationally driven communications over a period of time, while we're continuing to engage them in the way we always have, through follow-up calls, through scheduled visits, and in other traditional ways of connecting and working with patients and consumers. So what do we link to? The information is not the problem. I mean, there's a lot of information out there, and I think we all would agree, and public health departments have done an amazing job of finding the information and making it available on their website and saying, these are the 3 videos, or these are the 3 articles that you want to read or learn or view around diabetes. So finding the information is our job. How we disseminate it and link it so that way that individual gets the right information at the right time is where something like text and email can come in to drip out pieces of information that we find or curate, as the term goes in communications, and then publish or share on our health department sites. We've focused our discussion and the activities around our training and workshops around the Capital the Capital Region PHIP and the Community Health Needs Assessment in the top priorities, the ones that seem to rise to the top across all 6 regions in our PHIP. So it's not to say that these ideas and tactics and strategies can't be leveraged for other health priorities, because they can. But a lot of what we've focused our time on is the top health priorities. When we talk about email, we want to look at what we call email service providers, and these are very important. They're relatively low cost. Here's a collection of them. There's many more. If you're already using one and you're happy with it, please continue. Don't switch to these. But we got some examples of a few that we have seen other health departments use, and that are easy to use. Simply put, easy to use and relatively inexpensive. But they're an important piece, because what we don't want to do is we don't want to take an email of 100, 200, 300, 400 people, whatever size our list is, and kind of do the BCC approach, where we send an email to the first person, then we BCC everybody else, or send the email to ourselves and then BCC everybody else. Because for one, that can damage our ability to email, and it can also leave us without some of the important metrics we need to demonstrate impact and how we're doing and what's working, what's not working, what people are interested in. So this is not a technical discussion about these providers, but if you are looking to get started and consider, take a look at these. Feel free to reach out to us. Contact information is at the end of this presentation. But email service providers are an important piece. And why are they important? Well, beyond making sure that we're sending emails using best practices and in compliance with all federal laws and regulations around bulk communications and email, they're important because they allow us to demonstrate results and metrics. So here's a little snapshot of some stuff that we've done for the Capital Region, or for the Healthy Capital District Initiative, in some of our quarterly emails, and it's just a snapshot. And what we have here is more of a stakeholder engagement program, but behind each one of these we can see the individuals. So we're all under pressure to demonstrate results, to show that what we're doing is having an impact at some level. And this is one of the ways in which we can do that, because when we send emails, we can show open rates, we can show click-through rates, and then as we get more sophisticated over time, we can even start to identify those individuals who are expressing a strong interest or desire in the information, which can then help us prioritize our resources around follow-up. That's a phase 2 or phase 3 part of implementation, but initially, just being able to demonstrate and show and see what's working, what people are opening, clicking on, can help to inform where we should be spending our time and how we should be spending our efforts, and in our reporting activities for grants and future funding. The anatomy of an email. Most of this is something we're all familiar with. Subject line, to, from, name, greeting, body of an email, signature, and then if we're sending bulk emails, we want to make sure we have an unsubscribe. So the body of an email can be as simple as 1 or 2 or 3 sentences, or it could be a fully developed newsletter style. It really depends on who we're targeting, what's the message communication, and what's the goal of it. But notice that just under the subject line, and this is something you kind of don't see in a lot of these systems, but we have the preheader. So the preheader is really the equivalent to that first line of text. So if you want to force a first line of text, which you see here, what's the value in communicating with somebody that didn't open an email, but we know has expressed an interest in learning more about how to manage their diabetes, for example. If when we get the subject line and we get that first line of text into their inbox, it's an immeasurable value of that preheader text, just because we can't measure it, just because we don't know exactly how many people saw that message. We can only measure open and click-through data. Data, just like the health data, it's like an iceberg, where at the tip you see a portion of data that we can track and measure, and we know that there's a lot going on under the surface. Just because we can't see it doesn't mean it's not there. And communication data is very much like that. And we find snippets of activity to track, but that's not tracking everything that's happening across the community. So what's the value of taking some time and thinking through a subject line, and then also thinking through how this might work with just that preheader text, or just that first line of information, when it comes to connecting and motivating and reminding people about their health goals and what they need to do to live healthier lives. How do we build our list? Building our list is obviously a very important part of this. One of the ways to build our list is to put sign-up forms on our website. Another way to build our list is to find partner organizations or people who already have the group that we want to engage with. There's a lot of different strategies to build a list, and how we kind of incorporate these into our websites or into partner websites. There's a lot of options, but we want to focus on growing our list and look at other organizations or partners that might already have a list that we could leverage to get started very quickly. SMS or text message providers, very similar to email. They're a third-party provider. A lot of counties are starting to, maybe not so much at the local health department level, but at the county level and in public safety, have maybe made investments in text-based communications or platforms. So maybe you want to just see, is there any plans to purchase programs for the county? But what we've offered here is just 2 relatively simple. Call loop, I think, is by far the simplest. We set up a very basic text, a very basic text campaign where you text demo 2217 to 38470, and you'll get an immediate response back. And it took us 10 minutes to set that up. It's relatively affordable, and it's something that you could use to start piloting a program. I mean, at the end of the day, what we're looking at is getting started within a health priority and looking at a population or even a subpopulation to implement some of these ideas and strategies, and do it in a way that we can find out what works for your department, and then leave behind the things that don't work. Now we're going to move into part 2 of this workshop, and in here we're looking at federal, state, local, and regional organizations that are using email and text-based messaging to communicate with the population and the community. So here, Georgia Department of Public Health, they have their primary messages that they're circulating on their homepage, and just below the fold, as you go on, you see on the right sidebar they have a subscribe to our newsletter button, which then has the ability to ultimately put your email address in, and then they start to send you a series of information and emails as a result. Here's an example, and notice they're using constant contact. So this one, immediately after Liz signed up, signed up, she submitted the button, and the email came into her inbox. Now they have the ability to communicate with us at times of their choosing, using a very simple to use email platform called Constant Contact. Long Beach Health and Human Services, here's another one. Notice on the right sidebar they got a newsletter button, and then when you sign up, you start to receive a series of newsletters, bi-weekly newsletters that they're using to engage the community and connect with employers and consumers alike. Now I want to look at a larger organization, American Lung Association, and one of the reasons we picked this one is, yes, they are a national organization. Yes, they have resources and funding around communications that we don't have at a local health department level. But the things they're doing and the way they're implementing it when it comes to the email piece is something that we can all do. So the point here is that we don't need to have major communication teams and agencies and big communication budgets to start implementing some of this stuff. Now you notice at the very bottom they have a submit button. And the submit button works very much like what you saw with the Georgia Health Department. Once you put your email address in, now you're connected. Now you get the chance to send this individual a variety of information. American Diabetes Association, very much like American Lung, well-funded, got a good communication team, turns to agencies from time to time, and but they're not doing anything that we can't do at a local health department level. They have a basic sign-up form. They, from there, when you sign up, you start to receive a series of messages, an automated message that goes out, thank you for signing up, and from there they start to use it to engage their community. A lot of what they're doing at the national level is around advocacy and policy driven, but they can start to use this and send a series of messages to the members on their list. So this works whether you're looking to engage stakeholders, partners, providers, or individual consumers. Here's another example of how they've structured their email and used it to communicate with their community. Orange County Healthier Together, another example that again is relatively simple, straightforward to implement. They're using the Healthier Cities platform, but just below the fold, again, as you scroll down, you see a sign up for email updates. Click that, you put your email address in, and then you start to receive a series of emails, again, using that platform that we discussed a little earlier, Constant Contact. Here's another set of emails that they've used to communicate and connect with their community around events and workshops that are coming up. Coastal Georgia Indicators Coalition. So these guys is another kind of regional organization, and they're on the Healthier Cities platform, and But again, they have newsletter options just below the fold. You sign up, and very, very easy to implement once again. And then you see what is a very newsletter style piece that they're using, probably monthly and quarterly. And this one is clearly a monthly campaign because it has October versus Q1, Q2, Q3 type thing. And here's a few other examples of styles and how they've put their communications together and what they're communicating to different audiences as a result of being a member of their email list. Now I want to move into text, and a lot of the same things that we talked about with email apply to text. So text-based messaging is not just something for adolescents and teens, but we know that adolescents and teens, when it comes to text-based communication, are heavier users of that communication platform and medium than most other segments of the population. But here's an example of how one department used this to connect and engage with adolescents around taking their medications for HIV, because they essentially recognize that adolescents are 4 times more likely than adults to forget to take their medications or to take it at the wrong time. So they engaged a text-based program to connect and educate adolescents who have tested positive for HIV to improve their rate of taking their medications and taking them on time. Another great example of text-based messaging is Rhode Island Department of Health used it to help teens quit smoking. So they have a website you go to, and you ultimately can sign up to receive a series of text-based messages, and here are examples of them. Again, using something like Call Loop. These are really simple to set up. The nice thing about text-based communications from my point of view is what you need to create for content is really, really minimal. You don't need to create a lot of content, where emails kind of lend themselves to a bit more content and a little bit more development time, where creating a 3-part series of emails that links to some relevant information can be done very quickly. But here's some examples of what Rhode Island Department of Health has done to just kind of vary it up. And they're using quit lines as part of it. They're using links. They're kind of trying to address certain behaviors or moods or emotions that come when individuals are trying to quit smoking. But these are examples that we can look at and use to leverage the thinking to see how they might apply to some of our communication programs and public health education initiatives. Please call, write, email questions. Happy to jump on a call. Happy to answer questions via email. There's a lot here, and this is really an introduction into some of these ideas that are hopefully very helpful as you start to look at planning for the future, look at how you can implement some new ideas and strategies into your public health communications. Thank you for joining me, and please don't hesitate to reach out if I can help in any way. Thank you and have a great day.